Ah, so I'm not going to waste too much time. We're just going to get into the conversation for today. Just very quickly, before we do, let me share my screen with you. All right. Very good. Good to see everyone. Let's get started here. Again, welcome, good afternoon, and welcome to the Dean's Forum. Today, we are going to continue with our discussion on all things COVID, part 3. However, we are going to have question and answer session, Q&A, share relevant information as well as we see fit without any lead or panels for today, as we did in parts 1 and 2. We welcome you to jump right in whenever you feel like to ask question or give a comment. Let's try to keep it brief to give others opportunity to answer or ask their own questions. Again, my name is Alex Ibe, Dean of Humanities and Sciences, and we have my co-host today is Dr. Dana Brewer, Chair of Humanities, and she will be moderating the chat room as well as recognizing you to speak when necessary. Here is the preview of some of what we're going to be addressing today, and many more as you bring them forward. We are not going to address them in any particular order. So feel free to comment or ask questions in any area that you see fit. But before we do, I have a few updates and statistics to share just to remind us all the seriousness and importance of COVID-19. Let's begin with the statistics. We know, right now, we know that in Parker County, for example, the COVID is over 3,800 cases of COVID in Parker County. And in the state of Texas, we have over 1.25 million. In the United States as a whole, we have more than 13.4 million. And worldwide, we have more than 62.8 million cases of COVID as we speak. Those are the statistics. They are real. They are good. They are numbers. They are someone who is sick or who has family members who is sick. So few updates. Let me go through few updates before we start getting into the previews. As we all know, the USDA plans to make a decision on Pfizer and Moderna's vaccine sometime in December. I believe they push the date a little bit to December 10th. That's when they're going to meet and make a decision as to the approval. I think Moderna is submitting their request today to their authorization they're submitting the application for authorization to FDA today. All right. And then, of course, the other thing is in England, Britain, the COVID-19 infectious rate dropped roughly by 30%. Why? Because of a second national lockdown. It works. The other thing is in Rhode Island. Rhode Island which was a model for the country some few months ago with limited cases of COVID, now they have the hospital has reached capacity in the state of Rhode Island. So people are asked to stay home, not to go out. Even family members are not supposed to see each other unless they live in the same household. That is the new mandate from the governor of Rhode Island. In West Virginia, hospitals, they tell hospitals to prepare to delay elective surgeries. What happened during the early stages of this pandemic? Okay, to delay elective surgeries. And this is in West Virginia. Okay, and also we have, I'm going to get to the vaccine a little bit. In New York, New York will begin using hospitalization as a main metric to trigger closure, according to the governor. So as the rate of the COVID goes up, hospitalization rate goes up, that could give them a mandate on how to proceed, if to go on a lockdown or not. And of course, the metrics they are using in New York is they will be looking at the number of hospitalizations and the zip code they are coming from, the hotspot. And they will start shutting down those areas based on the number of COVID from those zip codes that are being hospitalized. And that's the approach, the shift in terms of New York managing the COVID. All right. Also, Pennsylvania clearly has surpassed their hospitalization rate. During the peak in the spring, they peaked, but now they have surpassed that rate drastically in Pennsylvania. So, and the case continue on and on and on. Is there end in sight? Yes. But before we get to the end in sight, we have a lot of work to do, right? We have a lot of work to do. And one of the things, job we have to do is, let me just start by saying that we cannot give up right now because we have gone halfway through the whole process, okay? This is a time of excellence, of exceptionalism, and the courage to do the right thing. It is not a time to be selfish, but a time to be selfless. It is not a time to be irresponsible. It is a time to be a good citizen, to show good citizenship instead of civic irresponsibility. And let me share a quote from JFK. He said that if we are to go only halfway or reduce our sights in the face of difficulty, it will be better to not go at all. We have come this far in this pandemic, and with the end in sight, we cannot stop doing all the right things right now. Because if we don't, there's going to be a surge, and there's going to be a surge on top of the surge, because the surge is going to be post-Thanksgiving, and then the surge post-Christmas break. So can we mitigate that? Can we reduce it? Yes. And how can we do that? By doing the right thing. As you all well know, a lot of us did not do the right thing over the Thanksgiving break. We had a record number of travelers, people traveling through the airport and everywhere. So the thing here now is, before we get to how do you assess your risk of exposure over these holidays, let's talk about managing the stress of pandemic through school or work. So at this point, I'm going to allow you to jump in and comment or ask questions about managing stress during this pandemic as it pertains to schoolwork, either as a student or as a faculty member, and how you plan to finish the semester in the next couple of weeks. Anybody can jump in.
As a student, I feel stressed when my classmates won't wear their masks even after I ask them to put them on.
Okay. Well, that has been a major concern of many, but overall, I will still give credit to our students as a whole. Majority of our students are doing the right thing. Few, try to be defiant, um, not putting, not wanting to wear the mask and not wearing the mask properly. All right, but we are going, it is the responsibility of every one of us, especially the faculty members in your class, in your respective classrooms, to remind your students about the importance. Why it's not about them, it's about we, all of us. Okay, if you don't want to cover your nose and you are releasing droplets through your nose, you are endangering those people around you. But those who wear their masks properly are protecting you. Why would you want others to protect you and you are not doing your part to protect them? That's the question you should ask yourself. It's not time to be selfish. It's time to be selfless and good citizenship. Yes. Yes, go ahead, Jessica. Jessica?
I definitely agree. I feel like it's almost uncomfortable when you wear the mask, or at least for me, I wear it all the time because I have type 1 diabetes. And so many more times than not, when just the other day, I went and got my oil changed, and the man was laughing at me that I was wearing it. And he kept telling me, it's okay, you can take it off. And finally, I told him, well, it's actually for myself because I have type 1 diabetes, and, I'm just trying to keep myself safe even. And people tend to look at you almost like they're angry if you don't take it off.
That is very sad to know that amongst us we have a lot of people who are very irresponsible. This virus is real. It's not. It has no religion or political boundary. It is real. It infects anybody, and it can kill anybody, regardless of age or wealth or politics or religion or race. So if somebody tells you it's okay to not wear your mask, to take it off, that person doesn't like you. They don't wish you well. And I would rather not give them my business. I will take my business somewhere else. All right. So I wish I know where you went and who told you that, and to send them a very strong message that that is unacceptable. That is not being a good citizen. Any other comment? All right. Let me have some of the instructors. How are you managing? How are you going to? What's your plan? Post Thanksgiving, how are you planning on managing the stress level that your students will be facing as they take the final exams? Do you have anything special how are you going to end the semester? Dr. Overstreet?
Oh, well, I was going to respond to, is it Jessica?
Yeah.
Yeah, I was just going to, just to let you know that I think on 3 or 4 occasions, I've written emails to management about those kinds of issues where someone wasn't wearing masks, or I had at 2 restaurants, I had waiters with their masks around their throat. And then I had, I can't remember. Anyway, 4 situations, and this is since maybe May, and I've gotten very, very good responses from the management, and they said, thank you for letting us know, and we will attend to that. So, just because it's so hard to go through that situation. Now, I wasn't being berated for wearing a mask, but I was just thinking, in fact, I told one waiter, I said, put your mask on. I mean, he's standing right over me with his mask around his neck. What's the point? So feel empowered. You can do that, and they respond in positive ways. I think they want to know. They do want to know.
Definitely. Definitely. That's very good. Very good to know. Yes, Susan.
Oh, yeah, Jessica. Yeah, hang in there. I know in my classroom, I feel I have the authority to say, mask over nose, because that's the tendency for people to wear them improperly. But yeah, out and about, it's really hard to kind of ask people to do that. And I've found myself really backing up more and sometimes wearing an N95, and I just keep my distance and make it shorter. And so, yes, I think that's a great idea to email management, and then also, maybe to say something about how you were condescended for wearing a mask, and little do they know you have a underlying condition. So I think people aren't thinking when they say things, and yeah, it's a tough time now. I find myself defaulting into being polite when I just need to be assertive and say, even to my friends, please put your mask on. And if they don't, then just say, I've got to go. But I have to think about that first. I feel like I get caught off guard a lot with people's lax behavior, but it's my responsibility. But I just wanted to say, I read in the New York Times she was a neurobiologist, psychologist, or something. And she was talking about this pandemic being so stressful on us, and that we have a body budget, that our bodies, our brains are really set up to survive, to eat, rest, procreate, not to think. Thinking came later. And she talked about a body budget, and she said it was really important when we get down, it's, am I hydrated? Have I eaten? Have I rested? Do I need to move? So it was interesting that she kind of brought it back to just taking care of our physical body and our body budget. So I think this is a time to really, for me to focus on that, and to remind the students about that too.
Excellent. Wonderful. That's a very good advice. Yeah, very good advice. Any other comment on that? Stress?
I would just try to say, obviously, we don't have control over other people and only our own actions. And I know it's frustrating when people don't follow the rules because it's irresponsible. But people are fatigued, so to speak, emotionally and mentally. So I could just say, just do your part, and you wear your mask and try to alleviate yourself from situations if possible. I know that a lot of people at work are getting it outside of work. So it is spreading here even. I work at 2 different fire departments, and people are getting it at their other fire departments. So it's affecting even healthcare providers. So it is obviously a real thing. People just tend to not care until it affects them personally, is what I tend to find out. And people have died at their family members from work. So it is pretty serious, I'd say. Yeah. That's all I got, really.
Very good. Very good. Thank you, Josh. The let's talk about the assess your risk of exposure. Since we are now post Thanksgiving, the thing is you have to know your contacts. That's the most important thing. Know who you're coming in contact with on a daily basis. And if you know those, and I hope they also know their own contacts, who they come in contact with, where you met those people, and how many of you in a group, very important. Are your contacts students or essential workers or elderly? How many households? How many households, excuse me, how many households come together during that meeting? For example, during this Thanksgiving, if you attended any gathering of 2 or 3 or more different households together, then we suggest you get tested for COVID-19. That is just the truth, and that is what all the healthcare professionals have been talking about all day long, yesterday and today, letting you know that when we get together and you have been working, you have a job that you come in contact with different people, or you have kids who are in school who come in contact with different people, and then you decide to visit each other for Thanksgiving, saying because it's family, but that's not good. That's not good enough. That is not good. That because you do not live in the same household, you do not breathe each other every day. So coming together and spending hours together is not an ideal thing. And then when you get together, are you social distancing? Indoors and outdoors? Do you have your masks on? Indoors and outdoors? If indoors, are the windows open for proper ventilation? If riding in the car, some people will tell you that when you're riding in the car with other people to put down the windows. Actually, no. To have the air conditioning on is much better than putting down the windows, because when you put down the windows and there are 3 or 4 different people from different households, the wind is blowing in all over the place. Okay, so it's better to have the windows up and have the air conditioning running, but to have your mask on while you're together in the same car. All right. So any question? Let's talk about those. How do you assess your exposure? What are the risk factors? If anybody want to jump in, if you have any comment. Anybody can jump in. Yes, Sue.
Well, I wrote it in the chat. I heard Dr. Burke say over the weekend, she said that if you've traveled, been in the airports, or been in large gatherings, over this holiday, to just assume that you're infected. That's how widespread community spread the virus is now.
That is correct. That is correct. And even outdoors, when you go to the grocery store, I see people walking the grocery store, they have their mask in their hand, coming out of their car. They wait till they get to the door of the grocery store, they put it on. They go in there, they shop. As soon as they come out, they yank it off as if they are mad, wearing the mask. And see them walking at the parking lot, and then all of a sudden they sneeze with no mask on. And it's windy. You see, when we talk about social distancing, somebody if you're outdoor, and maybe your neighbor, in their backyard, they don't have any mask on, and you're in your backyard, and they sneeze, and the wind is blowing, you are at risk. Forget about the 6 feet thing. 6 feet doesn't work. 10 feet, 20 feet doesn't work. When it's windy outside and somebody sneezes or talking loud and laughing because they are releasing droplets that are being carried further away. That is the truth.
I have a comment to make, and it's about, I walk a lot and I'm on the Trinity Trail, and I keep thinking that joggers are blowing machines. I mean, I have to wear a mask on the trail because people are coming up, and they're together and they're talking and they're blowing, and I think, this is bad. I haven't heard any commentary about jogging, but it has to be a risk factor.
Actually, there is in California. They just passed their new mandate yesterday. In California, if you are in the park or in the beach, you must put on your mask. If you are jogging or running, you must put on your mask. That is the new mandate in those places. And I think that ought to have been the mandate all along, because when you are out there, you are sweating and breathing hard and puffing, you are spreading the virus, no doubt about it. And remember now, we say we are asymptomatic. I don't have it, you don't have it. That's what we all say. But a lot of us harbor it. Majority of us have the virus in our system. It's just that we don't have enough load. Remember, it's the viral load that gets you sick. And the more exposure, the more the load increases. And that puts you at risk of getting sick. And then getting sick is one thing, but then getting sick to the point that you wind up in the hospital is a different thing. So that's why we are concerned, is because the hospital beds are shrinking and disappearing very fast. We know in Mineral Wells, the hospital bed is full. So if you live in Palo Pinto County, you are at risk. If you get sick, God forbid you get sick to the point of hospitalization, they will have to transport you to Weatherford, and Weatherford is almost full. Right? That is the truth. And Weatherford is not full because what? Because most people on the other side of Parker County, Aledo and stuff, they go to Fort Worth. If they're coming over here, Weatherford will be full by now as well. And that puts more people at risk, because you have far distance to travel to get to a hospital. So if we do the responsible things, we are doing it for those amongst us that are vulnerable. Those amongst us that when they get sick, they will need hospitalization. And if they get to the hospital, do they have a bed for them? If they need ventilation, how many of these hospitals have those ventilation capabilities? So those are the things. Yes, a lot of people are getting it and recovering. That's a good thing. But we still have a lot of people dying, right? A lot of people dying. And those people who are dying are human beings. They have families. They have loved ones. So literally millions of people are suffering because they've lost loved ones during this pandemic. All right, so how long should you quarantine? That's the question, right?
That's a debatable question, because some people don't even know they have it because they're asymptomatic. So we have a guy at work who got it. He didn't show any symptoms, got tested, was positive, and now he's not coming back to work till he gets the negative test. But it just shows that people forget that you could still get it without showing symptoms, and that's a risk as well.
That is very correct, Josh. That is very correct. So we tend to say, from the time of exposure, from the time of known exposure, you should quarantine for 14 days. And during that quarantine time, 7 days into that quarantine is when we suggest you get tested the first time. Not 2 days, not 3 days after the exposure. Wait about 7 days and get tested. Then if you test negative, that's okay. Then wait until the 14 days and get tested again. If you test negative, then you are in the clear. All right. But yes, Susie.
Oh, I just want to add in, I have a social worker colleague. She's a therapist at Cook Children's Hospital, and they've been working since March and had not had a positive COVID case. But she said when the children come in, you know, they're tested, and this young boy tested negative and had been tested every day, stayed in the hospital, and on the 8th day he tested positive. So it took that long, and so they had to, you know, send all the children home. The therapists were sent home. So I thought that was interesting that he came in, was negative, and on day 8 he tested positive, and he had only been in the hospital where he was tested every day.
Very interesting. Let me talk a little bit about that. There's also a possibility that that young boy or that young patient build up their viral load while they are in the hospital. Maybe they got it from the other case, little by little, and then that build up their system for them to then test positive at that time. Maybe if they had stayed at home by themselves in isolation, they could have still not test positive. There's a possibility of that. Yes, Dallas? Dallas,
Yes.
go ahead.
Yeah, I tested positive for COVID, not recently, but a while back, and I was one of the ones that had to quarantine for 16 days. I had to quarantine for 16 days. I got tested 3 separate times, and the last time I finally tested negative. And so I stayed in my, like, not even in my house, I stayed in my room for basically 16 days because my mom also has diabetes. So to keep her safe, I just stayed in my room for the whole 16 days.
And how are they caring for you? Who was caring for you while you were in your room for 16 days?
I had this there was this little table outside my door. So like my brother and stepdad would bring me like food and water and stuff and set it on that table and knock and then leave. And then I'd put a mask on and then go out and grab it and then get back in my room.
And then when you are done eating, how do you put back the dishes out there, or are you eating with disposables?
Yeah, it was mostly disposable foods. Nothing like with dishes or anything that could get the germs like attached to it. It was mostly disposables, and I had a trash can in my room. So
Wow. Well, I'm glad you're doing okay. You know, it's one of those stories where people get sick and they don't have somebody to care for them in their household.
yes,
That's the frightening part. But if you are lucky, you have somebody who can care for you at your house, then that's okay. But again, a lot of us have in our household, we have people who are very vulnerable, who have comorbidity, you know, and those are the scary part, you know. And then we also have sometimes our parents or grandparents who are up in age and live by themselves and if one of them should get sick, to care for each other becomes a problem. Becomes
yes,
a challenge, a major challenge.
very much.
Yeah. Good. Glad you're doing well, Dallas. Very glad you're doing well. And any other comment?
Yes, of course.
Go ahead.
So Dr. eBay,
Yes.
a couple of things. First of all, I think you kind of answered the question, but there's some talk about as few as 7 to 10 days to quarantine now. But are they still, is that still too new to make that are we still looking at 14, like you said, and test at 7?
Yes, this is because of this Thanksgiving. People travel from all over the country. And even though some people who travel they may not be in your, they may not be in your household, but chances are they will be, while they travel from different parts, they could travel into your city, and some of them visited the grocery store where you go to, or some of the public places where you go to. So that makes all of us very vulnerable because of that. Because some of them came from a hotspot area to your area, and that puts everybody in your area at risk, even though they did not come to your household per se. And so that's why this assessing your risk and then testing, 7 days becomes very important. But the sad part of it is this, as they ask some of those travelers, say, what are you going to do now when you get back home? Some of them say they're going to go back to work. Some say no, but some of them who are responsible quickly say, no, I'm going to quarantine myself for 14 days before I go back to work. So we don't know if that's what they're going to do or not. Nobody knows. All right. So again, it's question of being responsible. One of the things in my household, let me talk about my household very briefly. My daughter lives with us, my wife and I, and my son lives in Dallas. But so I told him, before Thanksgiving, just that weekend leading up to Thanksgiving, we all decided we're not going to go out, we're not going to do anything, we're all going to stay home, and he's going to stay home, isolate. And then no symptoms, no headache, no fever, no sniffling, none of those things. And then he can then travel from his apartment to our house on Thanksgiving Day. And that's what he did, and then came, because we were isolating, he was isolating, we all did that isolation for 5 days plus, And then when he came, we social distance, with windows open, only 4 of us, we social distance and talk, and that is what we did. And that's what we ask a lot of people to do, is that if you are going to be traveling to visit loved ones, try to isolate yourself or quarantine yourself for so many days before you embark on that travel, with hope that the person you are traveling to see also quarantine themselves. Okay, if they are not in isolation or quarantine, then that's going to defeat the purpose. All right, so it's got to be both sides. And that's why we are suggesting limiting visitation to only people in your household. When you have 2, 3 different households, people coming from different corners of the world or the state or the city for that matter, and you guys gathering together, is not an ideal thing. Go ahead.
Something that has come up a bit over in a couple of questions, basically.
Yes, please.
Reminds everyone about what the colleges, so not specific campuses, but the college's policies on mask wearing, on any social distance guidelines, and if students have concerns, to whom should they speak?
Well, the Weatherford College, of course, we have our guidelines, and we put out those guidelines at the very beginning of the semester. Thanks again to my department chairs. They did a fantastic job, and all the faculty members did a fantastic job, because we are proactive when people were still deliberating or try to consider what they're going to do, we were busy, as you can testify to this, all summer long. We're starting in April. We were meeting like every 2 weeks, strategizing on how to offer the classes. If we are going to bring classes as a hybridized or face-to-face or 50% or here and there, and we did those. We strategize and put those things down in writing. And then when time came to implement those things, it worked. The fact that the college put out these guidelines and we were able to minimize the number of students on campus at any given time is the reason why we don't have an explosive case of COVID as some institutions are having it, okay? The fact that we hybridize and form cohorts, bringing certain students on campus on certain days, minimizing their contact as well as the number of days on campus also help tremendously. Yes, there's nothing that is 100% proof, but it helped. It helped. So moving forward, I know in this next week, by the end of this week, is going to become the challenge. If we are going to start seeing more cases of COVID, it's going to be towards the end of the week from those people who traveled or gathered together for the Thanksgiving and leading into next week. And of course, the final exam starts next week. And so what are we going to be doing for those students if they get sick? If we are getting information that students are sick, or even faculty members or staff members are sick, what are we going to do? So those are the things we talked about pre-Thanksgiving, that to make sure that we are flexible in the way we are going to be conducting the final exams, as well as flexible in the way we are going to be delivering the remaining information or course materials, if you will, leading up to the final exam. But again, we are going to do our best to accommodate everyone, every student. And we are going to do our best to also accommodate every faculty member. But what we cannot do is to say, oh, semester is concluded today, I'm done, I've given my final exam. No, we cannot do that. We have to wait till the final exam week, and we have to continue class till the end of the semester, okay? Because that's the rule. That's by law. We have to do those things. So if somebody needs to be quarantined or isolated, if a student gets sick who is coming face to face, gets sick and they need to be in isolation, we should be able to grant them that that courtesy to stay home and finish out and take their exam at home, as long as they are feeling better, they are feeling well enough to be able to take those exams. And if they can't, if we feel that they are very sick to the point that they cannot even take the exam, my office will be authorizing those for an incomplete for those students and giving them time to recover and then take the exam on a later date, maybe sometime in the spring semester. But then the question then is, what are we going to do in the spring semester if this continues to rise this way? Right now, I will say all the guidelines we have in place from this fall is going to carry over into spring. That's for sure. That's going to carry over into spring. And we are going to continue to be flexible in terms of allowing students time off to complete their work at home, as well as faculty members to move their classes all online when they get sick, or if they feel sick, things like that. So again, is going to be on one-on-one basis and on a special need and special request basis. So, but the goal is to accommodate everyone as much as we can. I don't know. I think I digressed a little bit on your question. If not, then can you just?
Yeah, I think part of it too had to do with if people were feeling uncomfortable about, you know, again, what are the requirements, you know, mask wearing should be occurring in classes. And then if it's not, or people aren't masking in other places on campus and you're a student and you're concerned, is there a recourse for you?
Okay. Right, glad to, the thing here is you as a faculty member, you have control of your classroom. You have to let your students know they have to wear the mask as always, and they have to wear it properly. And you too have to set an example. You have to wear yours properly. And if you ask a student to wear their mask properly and they say no, they're not going to do it, or then you have to tell them to leave, or you know you are allowed to do that because they cannot endanger the lives of the rest of the students. If they refuse to leave, then you can call the Paul, the Chief Stone, and Chief Stone will will either come personally or send some of his officers to come in and remove the individual from the classroom. But again, we don't want it to get to that point. We haven't gotten to that point yet, but I will think that you as a faculty member should be able to have control of your classroom and have everybody doing the right thing.
But it's more from a student's perspective. So if it's just like any other student concern, basically, if the student feels that they're not getting a response from the instructor, then they would need to go to a chair and an administrator, correct?
Yes, if a student feels that their classmates are not wearing their mask properly, or even a student feels that their instructor is not wearing his or her mask properly, they can go and they can tell the instructor, can you put on your mask properly, or or go even to the department chair. Yes, they can do that. Yes, we want everybody to be proactive and take and let's get this done. Yes.
Oh, I just wanted to say, I remember at the faculty in-service that Chief Stone, someone said, send him to the police, and Chief Stone came up and said to, if a student, I guess this is coming from a faculty member, if a student refused to wear a mask, just send the student to student services.
Well, true, you can do that, but if it's more of a defiant thing, say I'm not going to leave, and you feel, then that's where you call the Chief Stone, because only a uniform officer will be able to make people move sometimes if they don't want to move, right? So that's where I get to that point. But ordinarily, yeah, student services, we don't want them to get overwhelmed. They do a whole lot of things, but if students test positive, they should contact student services, all right? And if students feel that their instructor is not enforcing the mask wearing guidelines properly, they can go to student services. Okay, or they can even go to the department chair, and you as the department chairs have a way of communicating with their faculty members and let them know to do the right thing. Or if not, come to me. Come to me, but I don't want you to come to me. Let me be the last resort, because when it gets to me, it gets ugly. So I would say, try not to let it get to me first. Let it end somewhere before it gets to me.
Dr. Ibe,
Yes.
Backing up to where you said that your office could assign an incomplete. At the start of the semester, VP Indy sent out an email that said if students are verified COVID positive, we are supposed to excuse the work that they miss while sick. Did that change?
Well, that didn't change, and that it didn't change and has not changed. The thing is here is you as a faculty member have you do have some leverage here. You do have we want you as the person teaching the class. You know if that student has acquired enough knowledge or credit to be able to to deserve a credit for that course. You should be able to make that determination and make that recommendation to my office, and then we can go from there. But my thing is we have to be more very flexible as much as we can. Yeah.
So I'm asking because I have 3 students here at the end who've contacted me to say that they are COVID positive. I told them that if they contacted student services and CC'd me and provided their documentation, that I've been directed that we can work with things at the end. And they say probably shouldn't need that because I'm feeling fairly okay right now. But just so I'm clear, what you're saying is that if those 3, like any of those 3, need to miss the last project, but I can show where they've done just fine on the prior 3 major projects, they have the skills that would meet the learning objectives, I need to contact your office and put it in writing and make a pitch for excusing that last major project?
Yes, but you don't have to go that far. You don't even have to put it in writing and make the pitch to me.
Okay.
You can just tell me, say, look, I am going to, I feel the students have earned enough skills, and knowledge for this class, and this is how I'm going to grade them, and this is the grade I'm going to give to them. And I cannot object to that, and nobody can object to that because you are the instructor of record.
Okay, thank you for that. Appreciate it.
Yeah. Any other concern? We've talked about the vaccines a little bit, and let's see what else. You guys saw about Nick Sabian, the head football coach of University of Alabama, and that he tested positive for COVID this past week. But in previous weeks, some weeks prior, he had tested positive, but they came out later on and said it was false positive. He quarantined himself for a couple of days, and they let him back and said it was false positive, and he came out and continued to coach. And then this time, he started having some symptoms, and they tested him again, and he's positive. So this time is actually true positive, not false positive. And that brings up the point, can you have COVID more than once? It's been documented now. We've seen people having it more than once. So that begs us to ask, how long do you have the immunity once you are infected the first time? The new data that is coming out is saying that those people who got reinfected about in less than 2 months after they've had it the first time, after they tested, negative from having it the first time. So that makes us feel that the antibody gives protection for about 1.5 months. So that is the give and take right now. But again, so with that in mind, that's going to determine how the vaccine is going to work. So if we get vaccine, are we going to get just 1 dose of vaccine or double dose of vaccine? So that is the thing. And if we get that vaccine, it's going to be double dose. When do we get the first one? And then when do you get the second one? That's another question to be asked. So those are the things we have to address moving forward. And the interesting thing about these vaccines, of course, when Pfizer came out and gave us those numbers, you know, and then Moderna came out and gave us those good numbers as well, then AstraZeneca came out with a beautiful number. So everybody's coming out with good numbers. Of when you're having 90% plus, that's remarkable. In the history of vaccine making, 60, 65%, 70%, we always say is excellent. But to have 90%, that's remarkable. That means the vaccines are very good. But the logistic on how to administer those vaccines becomes if we have people who are working on those right now. The one for Pfizer requires a temperature that is almost unbearable. But from the information that came out today, apparently American Airlines has been flying those vaccines all across the world. They will not mention where they flew them to, where they've been doing the trials and things. So they will not mention those, but they've been flying across the world at those low temperature to test the viability and efficacy of those vaccines. And it worked. It worked. It's just that when they get there, how long does it stay? Where do they say, put them? And how soon do they have to dispense all of them to patients? So that's Pfizer. But the one for Moderna can be stored just at below 20 degrees Celsius, which is your regular freezer in your kitchen, you know? So that one is more easy to manage, Moderna's one. But then the one for AstraZeneca is even more remarkable that you don't even have to refrigerate it. So we are having all these promises of different vaccines. We have 2 or 3 that are going to be announcing theirs in the next couple of weeks. So there'll be a lot of vaccines out there. They are all very efficacious and they give us hope. But the thing now is, what do we do between now and then when we get it? And that's where, again, why we keep talking about responsibility. Each and every one of us has to stay true to our moral sense and be responsible. All right? Having said that, let me go here and say, what do you do? Be a responsible citizen. Always wear your mask, regardless of what people think of you or say to you. I had one of my older brothers, himself and his wife, he lives in Nigeria, but he travels a lot, and he has his children and grandkids are all here in the States. So both of them, him and his wife, were here to visit in March before the lockdown, and they stayed, they never traveled back. So he was running his business from here back home. So they just traveled back to Nigeria just last week, both of them. But when they got to the airport in Nigeria, people were not wearing masks. People were laughing at them as they all embarked off the plane with their masks on. People were saying, what in the heck? What are you guys wearing masks for? But I pre-warned them before they travel, saying, yes, you are going to be confronted by some idiots. Yes, they are going to make fun of you and try to have you take them off. Don't listen to them, because you have been here for so many months. Your immune system has changed. Even though they might claim they don't have a lot of cases of COVID over there, but you are more vulnerable than they are. So you cannot let your guard down. You have to wear your mask. You have to social distance, and you have to continue to do the right thing. And that's what it's all about. People will try to make fun of people wearing it, calling you a sheep, or whatever the heck they call. But that's okay. I like to be a sheep any day, and they see through the end of the pandemic. All right, it's okay to be a sheep. All right, and again, if you're exposed, get tested. You know, and if you really like people around you, then self-quarantine or self-isolate. And always remember that you eat well, you sleep well, and you get some exercise on a daily basis. Those are the key. If you have older parents, they can exercise. They don't have to do it every day, but let them do some exercise, or maybe a walk extensively to increase their heart rate and improve their lung capacity, and give themselves a fighting chance should they get sick. Those are all why we encourage the exercise, okay? And if you need help, call someone. And if at any time you need my office, you know how to reach me. Again, I thank you all for joining us again today on this Dean's Forum. This is going to be the last Dean's Forum for the semester. And when we come back in the spring, the next Dean's Forum is going to start in February. And what I plan to do then is we are going to, because of the dynamics of things moving in the country, of this COVID, the vaccine, the politics, we are going to go back to the original topic, the very first topic we had 3 years ago when we started, or should I say 4 years ago when we started the Dean's Forum. Our first topic was on emotional intelligence. We are going to go back and visit emotional intelligence, how it makes us good students, good faculty members, good staff members, good citizens. And that's where we are going to start again, is emotional intelligence when next I see you. But until then, I say thank you so much and have yourself a wonderful day. Bye-bye now.